Living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
Choosing a Medicare plan can be a challenging and time-consuming process, but with the annual enrollment period in full swing, now is a great time to look into whether you need to choose a different plan based on your healthcare needs. Today we'll talk about the different Medicare options, the help that's available to you, and what you should consider when choosing a plan. Welcome to Healthy Living for Life, a show dedicated to helping you do just that. I'm your host, Beth Brown. Stay tuned. Welcome back to Healthy Living for Life. Joining me is Kimmy Everman, a program officer with Montana's Office on Aging. Thanks for coming on our show to talk with us about Medicare this morning, Kimmy.
Sure.
So let's focus on the basics first, if that's okay.
Sure.
What's the eligibility criteria for Medicare?
It's really easy. You need to be an American citizen and you need to have 40 work credits, which is about 10 years of full-time work. If you don't have that 10 years, the folks at Medicare will work with you to try to figure out a way for you to get Medicare, but maybe at a slightly higher fee.
Okay, gotcha. So there are different parts of Medicare, right? Can you just give us an overview of those different parts?
Sure. 4 parts, actually. Part A, which is your catastrophic or going to the hospital insurance coverage. Part B is when you're going to the doctor just regularly for checkups and things. Part C are called Medicare health plans or Medicare Advantage plans, and they encompass all the parts of Medicare. And then Part D, which is our newest part of Medicare, is for coverage of RX medications.
Okay, perfect. Can you talk about some of the different eligibility periods for Medicare?
Sure. These get a little bit more confusing, which that's why I want to first say, go to your SHIP counselor. I hope we can put their numbers on the screen because this is so important. Your initial enrollment period is an IEP, and that is 3 months before your 65th birthday, the month of your birthday, and then 3 months after. So you have a total of 7 months to get signed up. As I am a worrywart, I say do it as soon as you can, unless you have other reasons not to. The AEP is the annual enrollment period, and that's coming up really quickly. It's October 15th through December 7th, which is, of course, Pearl Harbor Day, and that is a time when people can sign up for either a different Part D plan, or they can sign up for a different Medicare Advantage plan, change over from original Medicare, etc. Really good time. The general enrollment period is the GEP, and that runs from January through March. And so if the person has missed that annual enrollment or their initial, that's when they're going to come to get enrolled in Medicare. Unfortunately, that person may face a penalty, and what I think is maybe the bigger consequence is that if you sign up during the general enrollment period, your benefits do not begin until July 1st of that year. So you're still stuck paying your own way medically for 6 months. And then there's also something we love as SHIP counselors. It's called the SEP, which is a special enrollment period. And that, we call it the get out of jail free card, because it helps us help Medicare beneficiaries move around in the Medicare system if they've made a mistake somehow and they need to move.
Okay. So do folks just sign up for one part under Original Medicare, or how does that work?
Original Medicare is an 80-20 split, which means Medicare pays 80% and the beneficiary pays 20%. A lot of times that beneficiary will say, well, I want to make sure that I can pay that 20%. So they may go and get a completely separate, but it goes along with original Medicare insurance policy called a supplemental insurance or a Medigap. These help the person cover that 20% that they're going to owe out of pocket. But they're a whole nother piece that goes along with the original Medicare.
What's the difference between original Medicare and Medicare supplement?
Just that, again, the supplement is a completely different sort of product. It's an insurance policy that's sold by a private organization. And if you want to find out more about that, you just call up your SHIP counselor locally, or you can also call the Commissioner on Securities and Insurance, because they are the ones who are administrating these plans, or overseeing them, not administrating, overseeing them, and they have lots of good information as well.
Great. So folks can call to get more information, but can you just give us a general overview about some of the different supplement plans?
Sure. They range from A to, I think it's M or N now. They're named A, B, C. And they are standardized. So every A from any company you buy is going to have exactly the same menu. B, C, D, exactly all the same. The only thing that they can do is give you more benefits. They can't give you less. Right now, over my tenure in SHIP, the Plan Fs have been quite popular. They help pay the person's, if they have to go to the hospital, they might help pay that copay that you pay when you go into the hospital for the first time. They help pay for some of the services that you are going to get. Where original Medicare, that's just your coverage, and the coverage is 80-20, 80%, 20%.
Okay. So you already talked about some examples of when someone might go for a supplement. But when would somebody look into getting one of those plans? Well,
you have to remember as a beneficiary that there's going to be a fee or a premium. So if you have that kind of financial support where you can do that, that's when you're looking.
Okay, great. We're about out of time, but can you give us a quick breakdown about Medicare Advantage plans? Right.
Medicare Advantage plans involve every piece of Medicare, A, B, C, and D. It's for folks that don't really have they don't really want to see the same physician all the time. They can get in pretty quickly and get out. And they often have extra benefits, maybe a little bit of dental, maybe a little bit of vision or hearing. So you need to look into that when you're looking at a Medicare Advantage plan.
Okay, perfect. And they differ per county, is that right?
It does, because of the way that CMS has them set up. They're by county, so you have to look and see, and probably talk to the company that you're looking at to make sure that they cover your company or your county.
Okay, thanks, Kimmy, so much. We do need to pause for a quick break, but there is help available for choosing a plan or just understanding the basics behind Medicare-related health plans. We're going to get that information right after this. Stay tuned.